right, everybody, we're going to bring on our guest, a Medicare for All advocate, and actually ran the healthcare system, I believe, in the state of Hawaii, and can talk about all of that. But let's bring on Dr. Stephen Kemble. Dr. Kemble, how are you today?
Hi, good.
Well, first of all, thank you for taking time to be on our show. And I was referred to you because you're a huge Medicare for All advocate, and you've been fighting for it in the state of Hawaii. And one of the things, go into a little bit the history of how, because each state is different, obviously, in the specifics of its Medicare plan, and how I want to talk about how each state, you know, we're probably not going to get Medicare for All on a federal level, not from Joe Biden and the Democrats, certainly not from the Republicans. So it seems like it really falls down to a state by state issue. And so give us a little history on what you've been doing with regards to the healthcare system in the state of Hawaii, and what you're specifically trying to do to get Medicare for All in that state.
Okay, Hawaii was ahead of the rest of the country when we passed the Prepaid Healthcare Act in 1974, which includes an employer mandate, which is part of the Affordable Care Act, and required comprehensive benefits, which are pretty standardized, and no pre-existing condition exclusions, and no deductibles. And the copays are limited to 10 to 20%. And anyone employed 20 hours a week or more has to be given health insurance by their employer. So we've had that in place since 1974, which put us ahead of the rest of the country. And we combined that with a relatively generous Medicaid program. But over the last couple of decades, our leadership status has eroded. And I think the first degradation happened when they privatized Medicaid in the form of Medicaid managed care, broke it up into 5 managed care plans. And the result is it largely drove doctors out of Medicaid. Whereas before that, all the doctors participated in Medicaid. And that's because they are suddenly expected to jump through all kinds of managed care hoops, which, even though the pay was always relatively low compared to commercial insurance, everyone was willing to accept it until they also had to deal with managed care hassles. And then they stopped taking Medicaid. So it's really become restricted to community health centers, and hospital-based clinics are the only ones taking Medicaid anymore. So I've been bothered for a long time. I trained in both internal medicine and psychiatry, and I'm a psychiatrist practicing in a primary care clinic, which is one of the hospital-based clinics serving mostly Medicaid patients. And I've been doing that since 1989. And I also joined Physicians for a National Health Program in 1989. So I've been concerned about Medicaid patients being treated as second-class healthcare patients for a long, long time. And I've always felt that a universal single-payer system would be the way to go. And I found out from following PNHP that it will also be the cheapest way to go, the most cost-effective way to go, the best for doctors, the best for patients, the best for businesses. The only losers with Medicare for All would be the insurance industry and maybe the pharmaceutical industry, which we still need, but they don't need to be making 50, 60% profit on drugs. So, you know, I think it's clearly the solution to all of our healthcare problems. Unfortunately, the country has been going in the direction of trying to privatize healthcare, break it up into competing private plans, and impose what I call the competitive insurance business model on healthcare, which is utterly inappropriate to healthcare. And the reason for that is that insurance is a system that was designed for risks that are expensive, infrequent, and unpredictable. You know, like lightning striking your house and having it burn down, or getting into a car accident or something like that. And provided the risk is expensive, unpredictable, and infrequent, then the way insurance works is by risk pooling, where everybody chips in their premium every month. And then the money is there for the few people that have a disaster and need it covered. And that's what insurance was designed for. Healthcare isn't like that. There's a ton of risk in healthcare that's predictable because of pre-existing conditions, demographics, social determinants of health. So it's not hard at all for an insurance company to say, this population is going to cost us more than that population. So their incentive is not to give you a better plan, it's to cherry pick the healthy people and push the sick people onto somebody else to avoid the risk. And when the more competitive it is, the worse that gets. We should never have relied on the insurance model for healthcare. It was stupid from the get-go. And now we're paying the price for it. And it costs way more to administer. It requires excluding people. It aggravates disparities in access to care. And it has insurance companies all trying to restrict and block care, block paying for care, block sick people from having access to care. I mean, the whole thing is perversely trying to undermine the very purpose of health insurance.
Yeah, and it's the thing that's so frustrating is like during the last two mainly Democratic primaries, is especially this last one that was in 2019 and 2020 when, you know, Bernie Sanders was a big Medicare for all, and the panelists of media who are on these big corporate channels that get all this money from big pharmaceuticals, they kept saying, oh, how are you going to pay for it? His plan's so expensive. And they never would explain, or they would pretend it wasn't accurate, what you're saying and what other Medicare for all proponents have said. Basically, the insurance system that we currently have is so expensive. And it, as you say, it excludes people. Tens of thousands of people die every year because they don't have health insurance. And so, I mean, I guess that's part of it. That's why I want to have you on the show. But how do we get over that? Then basically marketing propaganda that these big companies that have, you know, they spend tens of, if not hundreds of millions of dollars to push this narrative like, oh, they always say, how are you going to pay for Medicare for all? And oh boy, they always make it seem like it's this crazy, overly expensive thing, even though, as you and others point out, it is cheaper. And, you know, Europe has had systems like this for 70 years. So yeah. I'd like...
If we were to do exactly what we're doing now with paying for healthcare through health insurance companies, but expand coverage to everybody, make it universal, fill in the gaps, it would cost more. And then the question of how we're going to pay for it would be legitimate. The problem is the way we're doing it now is extremely expensive to administer, extremely. And by moving to a Medicare for all system, you could save 30%, 40% of the healthcare dollar on eliminating unnecessary administration, almost all of which is tied up in that insurance business model. So yeah, the insurance companies will say, it's going to cost more. You're expanding coverage. Of course, it's going to cost more, but they're assuming they're going to be in the mix. And the solution to it costing less is to get them out of the mix.
Right. And so how do we get around that with this massive lobby money and infrastructure that they have in place? Because they buy all this ad time on these big corporate networks, and then the pundits or journalists or whatever then make these, then they push this how are we going to pay for it narrative.
Yeah, it's you know, once you let the insurance system in, then they are able to profit off of healthcare, which is why they got in the first place. They saw all that healthcare is a big chunk of the economy. They saw an opportunity to skim some of that off for themselves. So they have pushed policies that justify their involvement in healthcare, use the profit that they skim off to pay for political contributions and keep the legislators in their pocket. And it's a vicious, corrupt cycle that we're caught in. The only way out of this is the public has to get outraged that their taxpayer dollars are being wasted in this way and really demand a change. And we have to demonize the insurance industry as the root cause of the dysfunction in our healthcare system. The insurance industry is busy blaming doctors, saying that we can't pay doctors with fee for service because then they'll have an incentive to deliver a lot of unnecessary care, which is an unproven assertion that's never, especially in primary care, nobody's ever found primary care doctors delivering a ton of unnecessary care because of fee for service. Maybe some for-profit hospitals do that. Maybe certain procedural specialists do that. Primary care has never done that. And so it's based on a lie that we have to get rid of fee for service. And if you get rid of fee for service, then you're talking about systems like capitation or accountable care organizations or HMOs that require insurance companies. And that's the way they lock themselves in, is by saying, you need us to manage care. You need us because we're going to save you money. It actually costs more. They've never shown savings ever, but they claim they're going to. They claim we just need more time. We just need to, go push the model further and we'll be able to demonstrate savings, but they've never done that. No one has ever done that with the insurance system. The solution is to get them out of the mix.
Yeah, it is. And as you're right, it is the thing, like Americans, because they're fed so much misinformation, they just need to like get involved and demand it and tell politicians that don't support it, we're voting you out. I don't care what party you're in. If you say you're going to be, yeah, it's and candidates that got elected on, hey, Medicare for all, and then they get into power, like, the squad, they won't fight for it. They just like, they talk about it, but they're not doing any like serious acts. They're not demanding it. They're not saying, well, we're not going to vote for Nancy Pelosi as Speaker of the House unless we get a floor vote. They just talk about it and they tweet about it, but there's no real fight for it, at least on the national level. So, but let's focus back more on the state level, because like the state of Washington sounds like they're getting close to maybe even getting enough signatures to get it on the next ballot, I believe, for the citizens. They've tried to do it here in California. They've tried to get single payer healthcare, but there's more of a demand for it. I think the pandemic highlighted how bad our system is and made a lot of people go, wait a minute, we should have free healthcare in the middle of this system, especially when we see these big corporations, not just in the healthcare industry, but there was record profits made while people are like living in the street or waiting in line for food. So what specifically are you trying to get done in the state of Hawaii to kind of give us, anybody, even people who are watching that don't live in Hawaii, how they can sort of use the model of how you're fighting for it to maybe try to implement it in their state?
Well, you said that I used to run the healthcare system in Hawaii. That's not true.
Okay.
Hawaii passed a law in 2009 to create the Hawaii Health Authority that was supposed to be responsible for overall health planning for the state and to guide us to a universal system covering all residents of Hawaii. And that law was passed over our then Republican Governor Lingel's veto in 2009, and she didn't implement it. And when Governor Abercrombie was elected in 2010, he had been our congressman before and was a single payer advocate when he was our congressman. So he became governor and we were all very hopeful. And he did indeed appoint the Hawaii Health Authority. And I was one of the original members of the Hawaii Health Authority that was supposed to do this according to Hawaii law. It's in Hawaii law. But at the same time, the Affordable Care Act passed. And Abercrombie had been close to the Obamas when Obama was born. He knew Obama's parents when Obama was born. They were all at the University of Hawaii together. And he wanted Hawaii to be the flagship for implementing the Affordable Care Act, which is built around the insurance model. So he didn't have any money in his budget for that. The legislature had given us $100,000 to start planning for a universal system. He took that money away from us. He gave it to a new task force, which was convened with money from the insurance companies to implement the Affordable Care Act around the insurance model. I was on all the key committees representing the Hawaii Health Authority, but I was ignored systematically throughout the whole process. We had lively discussions about the problems we were dealing with on the ground that all got left out of the minutes and ignored. And basically they rammed through what they wanted to do anyway and ignored any input from doctors, community health workers, anyone actually trying to take care of patients who was trying to say, we are having problems here. And they did whatever the insurance plans wanted. So the Hawaii Health Authority is still in law, but it's not functional. And it never got listened to by either the legislature or the governor. But in any case, we did spend 2.5 years planning for how to get there from here. And the basic idea at the state level is to take those healthcare programs that have state control, which is basically Medicaid and employee and retiree independent health coverage. State and county employees and retirees. Those two are under state control. If we were able to consolidate those as a single system that had a simplified, standardized way of paying doctors, that could pool money and pay hospitals with global budgets instead of billing fee for every little Band-Aid for $10 each. Pay them what it costs to run their operations, but don't give them an opportunity to profit off healthcare. Just make sure they're kept whole. Pay the doctors in a simpler, standardized way, and have Medicaid and the state employees in the same system, paid with the same fees and the same way. You could save 80–90% of the administrative savings you could achieve with a single payer system, and you would be evicting the insurance companies from running healthcare and taking it over under the state. So that's what we wanted to do. If we were, let's take Medicaid, for example. Medicaid is largely in about 80% of states, it's been turned over to competing managed care companies who are using the insurance business model. And this has invariably driven Medicaid costs up, even though they claim they're doing it to save money. No state has ever demonstrated savings from going to managed care. 2 states went the other direction. They had managed care for a while, kicked the managed care companies out. The state took back the insurance risk. So they're responsible for paying providers of care directly. And they hired a former insurance company as an administrative services contractor to do claims processing and credentialing and administrative support for quality improvement, things like that, but not to take insurance risk. When Oklahoma did this first, and they demonstrated improved physician participation and significant savings, and I don't have an exact figure, but it was somewhere in the range of 10% savings that they achieved by kicking the insurance companies out. And they started by having some counties with managed care organizations and some counties with the state running it and taking insurance risk, and found that the state was cheaper. So they kicked the insurance companies out and went to the whole state being state run. Connecticut noticed this, and they'd had managed care companies in place for a dozen years. They kicked them out in 2012. They took insurance risk back on the state. They paid primary care doctors, they increased their pay and paid them extra to coordinate care. Instead of asking an insurance company to do that, they asked primary care doctors to do that. So they raised their pay and gave them the responsibility for coordinating care. They used an administrative services only contract for necessary administration. And 6 years later, their physician participation had gone up about 30%. Their emergency room visits were down 25%. Their hospitalizations were down 6%. Their administrative costs went from about 20 to 25% down to 2.8%. So that's a tenfold reduction in administration. And their total per member Medicaid costs, everything included, including the cost of that administrative services only contractor, dropped by 14%. So they were paying 14% less per person 6 years out compared to when they kicked the insurance plans out. We have been trying to point this out to Hawaii's Medicaid program. You guys should take a serious look at this. This could save you big bucks, and it could reverse we're hemorrhaging doctors in Hawaii. We're down 1,000 doctors compared to what we need. And we've been losing 3 or 4% per year up to the pandemic, and it's been much more than that since then. Anyone who comes to Hawaii with a chronic health condition has got a problem. And if we were to give the power back to the doctors, we could attract doctors back to Hawaii. We could reverse the physician drain. We could save money. We could reduce administrative costs substantially. And this would set us up for a single payer system down the road, because we would already be running our Medicaid program as if it were a single payer system. You take the state and county employees and retirees, you do the same with them, combine it all as one system so you don't have discrimination against Medicaid, because the payment is the same regardless of which one you have. And we could cover 60% of the state right there with one program that was administratively much cheaper to run than what we're doing now. So that would be our goal.
The way you lay it out, it's so clear how these are just better plans. And I want to go into specifically just so some people understand when you say like, ER and hospitalizations go down, that's because under our current system, because it's so expensive, there's not a lot, people don't want to do preventative, or they just can't afford insurance. So then by the time, you know, by the time they do get into the medical system, it's because the situation has gotten worse and they can only afford to go to an ER, or right? Isn't that correct? How preventative medicine saves money?
Most of these people have insurance. The problem is that very few doctors take Medicaid. Very few doctors even take Medicare anymore. The biggest commercial plan in Hawaii is HMSA, and they have gone whole hog on capitating primary care doctors and these payment transformation initiatives, which are administratively more expensive. And the result has been they're driving doctors out of practice rapidly. And as doctors get squeezed by this new payment system, they stop taking the lower paying plans like Medicare and Medicaid. So Hawaii is now ranked 51st by Wallet Hub. They do surveys nationwide on healthcare and related things. We're ranked 51st in doctors accepting new patients with Medicare. And Medicaid is even worse. So if you have insurance, Medicare, Medicaid, you can't find a doctor who will take it. And then you have to go to the emergency room.
Oh, wow. That's astounding. And I don't know if you have these statistics, but how is that like on a nationwide level?
There's a severe shortage of doctors willing to take Medicaid nationwide. Generally, the ones that do are the ones working in community health centers or some of the hospital clinics. And the hospitals, if the hospital is for profit, they won't take Medicaid. If they're not for profit, they get extra money to cover uninsured and underinsured, and they usually will take Medicaid. But those hospitals are getting closed. Hanneman in Philadelphia got closed, which was serving the underserved. There's a major hospital major hospitals in Atlanta and New Orleans. Chicago's on the ropes. You know, a lot of these major cities, their inner city hospitals are getting closed because they serve mostly Medicaid, and Medicaid is not paying well enough to keep them afloat. So unless they can attract a whole bunch of wealthy people with good insurance to offset that, they can't make it. So we're destroying hospitals rapidly in this country, and that's happening all over the country. And we're driving doctors out of Medicaid. Connecticut, the managed care plans claim they had great doctor networks. They claim that all these doctors are participating. Connecticut hired secret shopper surveys and found that when someone called around different doctors and asked if they would take them as a patient and said that they had Medicaid, the 3/4 of the doctors wouldn't take them. Wow. And there's a huge difference between what the health plans were claiming and the reality on the ground. Huge difference, massive difference.
Okay, so I mean, it's shocking, but unfortunately, it's not that shocking. Just knowing the general state of our healthcare system in this country. So how can we? And what are you advocating for, just for citizens of the state of Hawaii and just people in general throughout the U.S.? What like actions and steps can people take today to try to get more awareness about this, to try to get these laws passed, and to try to eventually try to get the insurance company out of there, because they're the ones driving up the cost for the most part, as you've outlined?
Well, after the administration, the Abercrombie administration, and then the EGA administration, which followed. And EGA had supported creation of the Hawaii Health Authority when he was Senate president. Once he became governor, he threw us under the bus again. So the same thing happened. So for a while, I kind of didn't know what to do and sort of was lying low. And then a guy here who's a social media activist named Dennis Miller said he was a Bernie-crat. He was into Bernie Sanders, and he said, "What's going on with single payer in Hawaii?" So he started Googling, and he found me and asked me, "What's going on with single payer in Hawaii?" So I told him, and he's been really pushing to get us out on Facebook and under Healthcare for All Hawaii at Facebook. And I've gotten actively involved with the Democratic Party of Hawaii Health Committee, which is also pushing Medicare for All and pushing deprivatization of Medicaid and state and county employee benefits. And we've been meeting with legislatures. We've been writing letters to the editor. We've been having public events. We've been trying to raise awareness, but it's a long slog. But eventually, this is going to have an effect on our legislators. Even if they're being paid off by the insurance industry, there's going to be enough of them that are concerned about what this is doing to the state and what it's doing to the people of Hawaii, that I think in the long run, we've got to win, but it's a long slog. It's hard.
Yeah. So yeah, I think Dennis is the one I've been in touch with, and I think he's involved with the rally that is going to be held in
on the 24th.
Yeah, on July 24th, which is it's a good thing for people to just get involved with, because if it's a lot of people show up, it's going to get some news coverage, and if it'll get news coverage hopefully locally, but then also if all these other cities have big turnouts, then you're going to have the national news is going to be like, they're going to be forced to cover this. And other thing too is, as I tell people who watch this show, call not just your senators and Congress people, but also your state representatives, which a lot of people forget about or don't realize, or they're not as in tune with that because they think it's all got to come out of Washington, D.C. And so, how can, even just like specific language people could use to call their state representatives and find out who
ultimately, a really effective single payer system that captures all funding sources should come from DC. But if we can kick the insurance industry out of Medicaid and state and county employee benefits and use insurance regulation maybe to include other employer groups, if we could combine those in a simplified universal system or nearly universal system, we would be going a long way toward laying the groundwork for a single payer system down the road. And that would have to happen at the state level, because those things are under state control, not federal control. And we could really push the ball forward by supporting those things. Deprivatize Medicaid, deprivatize state and county employee health benefits.
Yeah, that's a key component that I wasn't aware of, and I'm glad we had you on the show, is the state and county employee benefits, how that's a big player in all this, because that's a lot of money. That's a lot of people involved, and their health plans. That's a great point. So, well, Dr. Kemble, before we let you go, any other sort of final thoughts you want to leave with our audience and actions they can take, in addition to, get involved on events on July 24th, if there is one in their city, and calling their state representatives?
I think those are the most immediate things people can do, but this is a complex subject. It's hard for people to get their head around what's really going on. And so anyone who wants to educate themselves, I would encourage looking at Physicians for a National Health Program, or pnhp.org. It has a terrific website. They're a physician-driven national single-payer organization. There's an organization called One Payer States that I'm active with. I'm chair of their policy committee, which is people working for single-payer reform at the state level from all over the country. And that's One Payer States, all one word.com, or you can Google One Payer States. So those are other ways to get better informed and find out what's going on and find out what's happening. There's also Healthcare Now, which is a national grassroots organization promoting single payer. National Nurses United is another major union organization promoting single payer. Anyone who's involved with a union should be pushing their union to take this seriously, because unions have also been buying into the insurance model. Our major public employee unions have crossover between board of directors and our biggest health insurance company. So it's been corrupted. And we need the rank and file tend to support single payer, but the leadership are in bed with the insurance company. So the rank and file need to push harder.
That's all good. That's all good. Those are all good actions to take and good organizations for people to get involved with. And yeah, I say that a lot too. If you are a union member, I'm a union member, I'm in SAG-AFTRA, to push them as well. Because unions have power when they're used correctly. And that's one of the reasons they've tried to eviscerate the unions over the last 5 decades, is because the unions have been traditionally led a lot of movement. So I really appreciate, Dr. Kemble, you coming on the show and breaking down the specifics of this for us to understand, and also giving us actions and organizations to get involved with, like Healthcare Now and the other ones that you listed, because that, it's giving people actions are important. But and then just so everybody understands, just on the broad strokes, it's a thing I've talked about on the show for a long time, and any Medicare for All advocate has talked about, is the current system is more expensive. Like that alone, that we just got to make that clear to everybody. The current system is more expensive, and people die because they aren't a part of this system. So it's pretty awful that the richest country in the history of the world is still fighting this fight. But there is stuff that we can do. So, well, thank you so much, Dr. Kemble, for being on the show. We really appreciate the time, and hopefully we'll see you July 24th in Honolulu.
Okay.
All right. See you.
Mm-hmm.
Hey, everybody, it's Graham Elwood. We are going on the road, Ron Placone and I, in September and October. Check GrahamElwood.com for tour dates, probably coming to a city near you. A lot of these shows have sold out in the past. We haven't been on the road in a year and a half because of the pandemic. Come out and join us. The post-pandemic comedy tour. Go to GrahamElwood.com for tickets. New cities being announced every day. Join us and support what we do at patreon.com/Graham Elwood and rockfin.com/Graham Elwood. Blockchain cryptocurrency platform. Thank you. You're making Gotham great again.